Thank you for joining the last session of the conference, addressing social risk at scale, creating a roadmap for employers. Please welcome Ellen Kelsey, President and CEO, Business Group on Health, who will introduce our closing keynote speaker.
It is my pleasure to introduce our closing keynote session, addressing social risk at scale, creating a roadmap for employers, and our fantastic speaker is Dr. Trenor Williams. Trenor is a family physician, entrepreneur, former health system executive, and consulting leader. In 2017, he co-founded Socially Determined. Socially Determined is an analytics platform that integrates the social determinants of health with clinical and claims data in order to quantify and visualize social risk and the specific impacts on health and healthcare outcomes. Socially Determined creates holistic models of people, the communities they live in, and their interactions with the healthcare system. Through that process, the company creates a social determinants of health risk score, which helps health systems and health plans more comprehensively understand their patients and how best to support them. With more than 20 years of healthcare experience, Dr. Williams' unique perspective is formed at the intersection of healthcare and technology. Before beginning his consulting career, Dr. Williams was a medical director of family practice at Mammoth Hospital in California. He also served as lieutenant commander in the United States Naval Reserve. Dr. Williams completed his family practice residency at Kaiser Permanente in Los Angeles. He holds a Bachelor of Science in Biology from Virginia Tech and received his medical degree from Marshall University. We are so delighted that Trenor is the closing keynote for our conference. His work represents meaningful progress when it comes to improving health and health care for people whose social risks have not previously been understood nor addressed. If you'd like to submit any questions, please do so using the Q&A tab. Dr. Williams will respond to questions during the session. And without any further ado, Trenor, I'm so delighted to turn things over to you. Take it away.
Ellen, thank you so much, and thanks to the Business Group on Health. It's a really exciting opportunity to speak to all of your members today, and it's an exciting time. I'm a little amazed and thankful that so many organizations around the country, around the world, are focused on the topic of social determinants of health. One addition to the very kind introduction that you made, I'm the son of a social worker. My mom ran the Area Agency on Aging in Southwestern Virginia for 32 years. And so much of the reason that I went into family medicine, the reason that I do what I do today, is because of her, and having conversations with her about how her social workers inside somebody's home, seeing their pantry, their refrigerator, maybe their rugs on the floor, knew more about those individuals than I ever did as a family doc. And it was the opportunity to think much more holistically in this idea of visibility. And it's one of the reasons that I start with this slide a lot of times when when I'm fortunate enough to have these conversations, is starting with a really simple question. That if you know more about the people that you care about, those might be employees, might be patients, might think of them as members, as citizens, as consumers, but if you know more about them and the risk that they're exposed to in the communities in which they live and the risk for them personally, can you provide more efficient, more effective, more equitable support care for them? It's a simple question. It's harder to come together to do that. But in 2021, so many organizations, so many people, so many leaders are leaning in that way. And we believe that from a health and a healthcare standpoint, that stakeholders want efficient and effective and equitable healthcare. And that understanding social risk, understanding in a holistic way the challenges, the barriers that people have in their lives is the key to making that a reality. And so today I want to spend some time with everybody and talk about that, and talk about where we are as a healthcare ecosystem, where we are from an employer standpoint, what organizations from a health system, from a care delivery, from a health insurance standpoint, where those organizations are, some of the work that they are doing. And in many cases, it starts with this picture, which is the recognition that so much of what drives utilization, drives cost, and drives outcomes, clinical, experiential, and financial, happens outside the four walls of a clinic or outside the four walls of a hospital. We think about how crime and violence in a neighborhood may limit someone's ability to get out and exercise or even go to a care provider. That financial instability limits the choices that people have, or that housing instability, even homelessness, but certainly not limited to that, dramatically impacts how somebody thinks about their health and healthcare, as they're more concerned about keeping the lights on than maybe getting their prescriptions filled. Access to healthy food and sometimes any food options, available and affordable transportation so that you can get to where you need to get to. And health literacy, understanding and navigating our complex healthcare ecosystem. All of these factors contribute significantly, again, to utilization, cost, and outcomes, and much more than what happens inside the four walls, which, if that's the case, we believe that it is, then creating visibility and understanding of what these risks look like for people, the communities in which they live, and for them individually is critical. So I'm going to start first with some language, because words matter. And so the language of social determinants of health, and the way that we think about this, and I think see this across the nation, is that together each of the terms that I'll go through, these three, comprise social risk intelligence, greater understanding of social risk, again, for communities and for people. And at the community level, we think of that as social determinants of health. So the assets, the attributes, the resources in a given community, and how they impact an individual based on where they live or where they work, potentially. And if you use the example of food insecurity, that could be like living in a food desert, so without access to healthy food options. The next level down at an individual level and from a longitudinal standpoint is social risk. So based on my specific situation, my personal situation, what am I at risk for? And so from a food insecurity standpoint, carrying that analogy forward, that might be based on lack of income or savings. I'm at risk to be food insecure. And then the last piece is still at that individual level, but now instead of longitudinally at a point in time, thinking about social needs. So I've crossed that chasm from being at risk to having specific immediate needs that need to be addressed. So maybe for a person or a family at the end of a month, when SNAP dollars have run out, they have the inability to afford healthy food options for myself or for my family. So social determinants of health at a community level, risk exposure, social risk at an individual level, and social needs when those risks manifest themselves at a specific point in time. And we see organizations around the country addressing each of these layers of social risk intelligence as part of that. This is the exciting part too. This idea of addressing social risk and the social determinants of health isn't one part of our ecosystem's responsibility. It's not just one area that is leaning in right now in 2021 to have a significant impact for the people that they care for. It is everybody. I can't tell you how excited I am that that is actually the case. And just to give you a couple of examples as we walk through, I'll start at the top and work around. Health systems like ProMedica, based in Toledo, Ohio, the work that they have done now for more than a decade to focus on the most vulnerable populations in Northwest Ohio and now around the country is amazing. They built a food desert and they built a grocery store in the largest food desert in Toledo, Ohio, which is really amazing. To health plans like CVS, Aetna, that are integrating their approach from screening to activities and intervention for their Medicaid, Medicare Advantage, commercial populations in every market where they operate across the country. Foundations are leaning in and creating and providing capital and creating opportunities for organizations to leverage that money to invest in interventions. And they're expecting appropriately to help see measurement of that work, which is a real opportunity. Community-based organizations that, again, the rest of these partners around on the screen can't do this work alone, and so they rely on great community partners like DC Greens, who's an organization in Washington, DC focused on food justice and leading produce prescription work. To government organizations, the work certainly that's happening at a CMS level, every state Medicaid office who is pushing their MCOs to integrate social risk into the work that they do, to CMMI innovation projects that are going on around screening and reimbursement. Associations like American Hospital Association leaning in for their hospital and health system members as part of the work that they do, providing both research and intervention support as part of that. And even life science companies who are focused around diversity in clinical trials and the work that they do, both in selection and retention of vulnerable individuals, to thinking about how do they help address medication adherence for at-risk individuals. And lastly, and certainly not least, employers like McKesson, who have a dedicated group focused on social risk for their own employees and think about how they can update their benefit strategy to support their employees who are at risk. So together, the opportunity to lean in. And the last piece I would say here is what we're starting to see is organizations, rather than thinking about somebody as just a patient or just a member or just a citizen or a consumer or an employee, but together thinking of them as a person and leaning in together to decrease the amount of initial investment that it takes to address these risks and maximize the impact that they can actually have. Really exciting to see as part of that. So let's talk a little bit about some of the work that's going on in other sectors. Where we're starting to see organizations really lead in is take advantage of the data that exists from federal, state, publicly available data sets to commercial data providers that have robust information about communities, about businesses, about populations, and about individual people. And we see health systems, health plans, government agencies focused on quantifying that social risk, understanding at a domain level what risk looks like on the ground. So based on the availability of healthy food options, full service grocery stores, ratios of healthy to unhealthy food options, what the food landscape and what food risk looks like in a given community. And being able to do this at an individual level, again, maybe for their patients or their members or their citizens as part of that, and quantifying risk for individuals. So together creating building blocks to better understand the risks that people go through and using that data and that analytic process as a foundation from which to build on and act upon. So how are organizations utilizing this information? It's certainly not just in one singular way. So one of the first ways is starting to think about when individuals have similar clinical risk, why do we see such significant variation in their financial utilization and experiential outcomes? The ability to link social risk tied to clinical disease burden and utilization patterns to start to explain why some diabetics, again, who look the same from an acuity standpoint, have very different trajectories. And social risk can be the key to unlocking that unexplained variation. To predictive analytics and understanding based on, again, social risk, maybe disease utilization patterns, who is more likely to have an event that requires them to go to the emergency room that could be avoided, or a hospitalization or readmission, or they more or less likely to take their medications. Resource allocation and starting to think how organizations place their bets, where they invest time, energy, and money, prioritizing their efforts to have the greatest impact. And lastly, even things like care management. So the specific opportunity to address risks for an individual at a specific time based on their clinical and claims history and their social risk together. And as we see on the right-hand side, everything from, again, addressing one person at a time in a very tactical, thoughtful way to screen them maybe and provide care management solutions, to how organizations at a federal and a state level are starting to think about risk-adjusted reimbursement that integrates social risk factors with clinical acuity and claims information as part of it. So lots of ways for organizations that they're utilizing this data. A couple of examples just to walk you through as well. That data that organizations are gathering, again, is robust. Doing that in a secure way that appropriately addresses privacy, but for organizations that are delivering care, managing the support for an individual, having data and understanding the risks that they have, how far they live from a pharmacy, how far they live from a healthy food option, do they rent or own their home, and have they had an eviction history, what type of income are they receiving right now as part of that. And at an individual level, what we see organizations do is pulling that information into thinking about a population that shares a characteristic. So it may be individuals all in one contract, or maybe it's 900 individuals who all have diabetes or all have heart failure as part of that. So starting to coalesce cohorts of individuals that share characteristics and create a better understanding of those populations. So in this case, 58% of the individuals in this cohort make less than $40,000 a year. That economic resiliency may become really important. 39% of them don't own a vehicle. As you think about access issues as part of that. A significant proportion are eligible for SNAP dollars. You have limited number of individuals who only have a high school degree. As you start to put together these features of a population, it very specifically can help you think about interventions that organizations are deploying that have the highest likelihood of having impact. An example of that might be, so this is one specific population pulling down from that 900 individuals who have diabetes as their primary disease. This happens to be individuals all from one geographic region, and everybody of the 900, everybody had disease. If you go all the way down to the bottom of the funnel, approximately 350 of those individuals had severe risk for food insecurity and severe risk for health literacy issues. So 550 had lower risk, 350 had elevated risk. And of those individuals with elevated risk, their cost of care historically was $3,500 per person per year greater. That depth of understanding and that analytic precision allows that organization to think and act with precision. As you think about interventions that specifically can address those issues around health literacy, around food insecurity, so that those diabetics do better, have better experiential, clinical, and financial outcomes. One last example, and then we'll talk about some of the work going on and the opportunities in the employer space. I mentioned ProMedica before when I was going around the wheel from an ecosystem standpoint. So they're an IDN based in Toledo, Ohio, an amazing organization who has been focused around social determinants of health and social risk for more than a decade. One of the opportunities that they focused on was individuals inside that were either patients or members, sometimes they were both, that had elevated risk for financial insecurity. So financial strain was a big part, unfortunately, of their social risk. Identifying those individuals and then enrolling them in a financial opportunity center that pre-COVID was brick and mortar and evolved over 2020 to be a virtual support system that offered training and counseling to individuals around financial strain. And of the 800 individuals that participated in that program, ProMedica started to see significant results. 14% reduction in avoidable inpatient utilization, 33% reduction in low acuity ED visits, about a 6% increase in primary care visits. So we're getting people with chronic diseases to their primary care office. And fortunately for those individuals, about a $432 per person per month increase in their monthly income, and a 29-point increase in their average credit score. So really impactful results in a substantial population around that addresses financial strain for these individuals. So exciting to see what's possible, that this is the migration from pure altruism, this is what our foundation to do, to a sustainable business strategy that addresses social risk and drives measurable outcomes. One more example similar to that, this was a combination with a community-based organization, DC Greens, a health plan in AmeriHealth Caritas, and 5 different federally qualified healthcare centers in Washington, DC. Those individuals that were identified had both a clinical disease set, including prediabetes, diabetes, and high blood pressure, or high blood pressure, and they had food insecurity. Identify those individuals, they were enrolled in a program that provided a $20 prescription for fruits and vegetables every single week from the only freestanding full service grocery store in Ward 7 and Ward 8 in Washington, DC. They could do up to $80 a month and could renew that prescription every 3 months. Those individuals were enrolled in that program, saw a 20% drop in EMS utilization, a 44% drop in low acuity ED visits, 10% increase in primary care visits as part of that. And then for the giant who participated in this program, 28% of the population switched their prescriptions to giant, their medication prescriptions, to get them filled there. And their fruit and vegetable section saw a 2% increase in their growth. And the reason that those become important too is that your partners, as you think about interventions, are going to care about the metrics that matter to them as part of that. So really exciting, again, to see tangible results in a vulnerable population and bringing together health plan, government, retailer, as well as provider organizations as part of that. So let's spend just a couple of minutes talking about the opportunities on as employers are leaning in around the country in this space. I think one of the exciting things to think about is this is certainly, as you've seen from the slides before, an opportunity to address healthcare costs for your at-risk and vulnerable employees. But we know that social risk has greater impact outside or in addition to healthcare costs. As we think about the impact related to recruitment and turnover, engagement and satisfaction for your employees, presenteeism, absenteeism, and productivity, even performance and promotion. And so you have additional levers and measurable components that really can be important for the business as part of that. And when we look at the numbers across the nation, we see that absenteeism, especially in individuals with chronic disease, and we know that social risk is increasing the prevalence of chronic disease in our vulnerable populations, over $200 billion impact as part of that. And in general, just presenteeism as employees focus on whether it's from a financial insecurity standpoint, housing instability, how those factors impact presenteeism for your employees, to thinking about turnover and recruiting, training, onboarding, and bringing in new employees as part of organizations. So real financial impact, which is why one of the reasons we see organizations starting to lean in there together. So a couple of questions to address and to think about. With data that is available now, how can organizations start to create an informed approach that creates a better understanding of the risks that your employees have based on both where they live and their own personal situation to ultimately achieve measurable impact? And I think it really starts with organizations leaning in and understanding their employee base. And so do you know if your employees are struggling with food insecurity or housing instability, and where they are and what type of employees they might be? As you're thinking about this, do you have any programs that are starting to address social risk? How would you determine where those programs are? Is that a benefit? Is it part of a reward program? Is it a new partnership that you might deploy? In which geographic area, especially for many of you who are national employers as part of that? And how are you going to measure the impact that you're having. What are those metrics that will matter to you? Who's going to measure that, and what does that look like? And how do you start to think about the healthcare costs and the employer metrics that matter as part of that? All of those questions are answerable as you start to think through this. So maybe just a pathway right now to think about this. So providing social risk intelligence allows you to support your employees in a differentiated way. And it can start with community support, being able to gain insight and understanding of what's going on, especially for many of you, where you've got deep presence in your anchors in your community. Visibility into the risks at the community level matter and allows you to think about the investments that you might make, whether those are philanthropic, again, to interventions based on your employees that live there. The second piece might be just providing connections through a better understanding. Think of supply and demand. So understanding the demand-based side of your employees, the risks that they have may allow you to think specifically about what information, which intervention partners you make them aware of. So if you understand the communities, the assets, resources, and attributes of the communities where your employees live, and you understand the risk of your employees, you can start to think about making some of those connections. Maybe less formal, but making people aware of that. The third piece might be actually launching interventions, partnerships, and providing benefits there. So based on that supply and demand, based on that understanding of what risk looks like for those individuals, you can start to deploy a precision intervention strategy that addresses the biggest risks and has the highest likelihood of impact. And then the last is related to benefits. So actually designing net new benefits for your employees, working with your health plan partners to better provide resources and specific benefits that will address those needs of your employees. So there are lots of ways for organizations to start. It doesn't have to start all the way on the benefit side to have real impact for you all as an organization, as well as for your employees individually as part of that. So thank you all so much for the time today to spend with you. And now I'm looking forward to some Q&A from both the group and with you. Thanks.
Trenor, that was phenomenal. You threw so many great examples into that brief presentation of not only what employers can do, but also how other stakeholders, communities, health plans, other agencies are really rallying to this, very real need out there. So thank you for doing that. I think it brings to life very clearly the issues, but also perhaps a path forward. And I also appreciate just kind of the simple question that you started with of, if you knew more, could you do better? I think that's just really great framing. So thank you for that. And I could dive into probably 100 different places in terms of the Q&A and our conversation, but let's start with the employer. That is primarily our audience here today with their other partners, health plans and others who are really leaning into this. As you said, they are very seriously focused on it and they are wanting to have meaningful impact. But I think also when we hear from many of our employer members, they're overwhelmed with where to start. Yeah. And overwhelmed with even knowing where to start. And you mentioned data, and you mentioned that some data is already available to them. So if you could maybe kind of help them think through what are the data sources that exist today that are pretty easily to obtain, that at least give them a place to start.
Sure. And first of all, thank you. This is a lot of fun. And I really am thankful for the opportunity to be able to speak with you and all of the attendees. So first of all, I would say that everybody is struggling with where to start. So even advanced health systems and health plans, like this isn't new. So you shouldn't feel alone as part of that. Second thing that I would say when we think about starting points, I'm not sure that there's also a wrong answer. So there isn't like just one perfect place that you're trying to find and how do I use the data to get to this one specific place? It doesn't exist. The good news is that there are lots of appropriate starting points and the opportunity to think about how you align this with some of the priorities that you have as an organization, what's going on in the communities in which you serve, all should be part of how you think about that starting point. And then I would start with the data. So one of the first things to think about is And there will be, and I'm sure we will talk about data privacy and security and how much you should know or can know or want to know about your employees. So one of the things to think about is A, having those questions. And like I said, I'm sure we'll get to that. But one of the real opportunities is to be able to look at the communities that you serve and where you have presence from a facility standpoint and where your employees live. So understanding that and starting to look at the risks and the risk exposure that people have based on where they live and based on where your, again, facilities might be. There are good tools that are out there. The CDC provides a social vulnerability index at a community level. AHRQ is starting to give raw data available as part of that. And then you have organizations like us that have done some of that heavy lifting to quantify what risk exposure looks like in communities. But I think it starts with and should start with understanding the communities where your employees live. And then the second piece of that is at an individual level, starting to create some visibility of your own employees. And it can be as simple as the questions that you ask your own employees during the course of their employment, from maybe when they start an onboarding to from an ongoing standpoint to when do you start to utilize third-party partners that might help you gather more data in lots of different ways about your employee base.
I was going to ask that question about surveying employees, and if you're seeing employers go in that direction of asking employees to self-identify their needs or asking to identify, other issues that maybe wouldn't necessarily come up in an employment-based conversation, but do really get at some of these issues that you're talking about today.
Yeah, and I think it can be helpful as a adjunct and additive component to a broader information gathering strategy. What we have found that can be really helpful is if you start with a baseline understanding of the community and of people before you start to screen, you have a better sense of maybe what to ask, where to focus your efforts, where to have specific conversations with employees about risk that they might be exposed to. So if you look at a community risk model and map and understood that a significant proportion of your employees that made less than $50,000 a year, that many of them live in areas of high risk for food insecurity, it might change how you screen for them. And instead of asking maybe a top line question about food insecurity, you might start to ask deeper questions about how they're addressing that themselves as part of that. And so I think of that as an additive factor along with a deeper analytic strategy.
All right, let's go to the privacy one that you flagged a couple of times, and I absolutely was going to go there. So that is a big issue, right? From an employer perspective about the data they capture and track and utilize, but then also from an individual perspective about the data that is being collected on them. So how should we think about that? How do we reassure people that it is being used appropriately, et cetera?
So I think there are so many, this could be its own session in and of itself, and it should be. So one starts with from your own data and security officers that you might have at your organization, their comfort level as part of this. And this is going to be and should be more than just what you can do from a legal or regulatory standpoint. You're also going to want to think about from a messaging standpoint and an employee engagement, what opportunities that this actually creates for you. So I'll just say that at a broad level that becomes really important. The second aspect that I think organizations start to think out is, one, what data do we already have access to? So sometimes data like income is seen as a very sensitive piece of information. Employers are the ones who actually have that. And so you're already dealing with sensitive information on a daily and regular basis as part of that. Another aspect is start to think who in the organization can and or should have access to this information. So it's not everybody. So starting to think about how do you partition that data, who can get access to it, who should have access to it, what are they going to use that data for as part of that. And then the last piece that I think becomes really important, and this is where organizations like mine, but we're certainly not the only one, who do you partner with? And sometimes it's easier to work with a third party. And there are different certifications, things like high trust, that allows organizations like ours to operate with PII and PHI. So spending time doing the thoughtful vetting of your partners with how they manage sensitive health and non-health data, I think becomes really important. And sometimes even easier to think about how you partner with somebody rather than dealing with the information or managing that sensitive information on your own, leveraging a partner who has the security province to be able to do that for you, and instead provide metrics instead of individual data, or provide roll-ups. Like if we think about all employees at a certain job function in a certain geography, and roll that information up that can be used from an intervention or a benefit standpoint without having to see the individual employee's information.
I like when I asked the first question, you started with, we just need to start, right? And perfect can so often be the enemy of good. And we just need to start somewhere. And over time, maybe more data become building blocks, that we build a more robust set of data that allows for a more robust strategy, but that should not prevent us from starting somewhere or anywhere.
Right. It's so true. And that just getting over, having a little bit of organizational momentum to get over that initial hump to start, to lean in where organizations are. And that, I guess, really is the amazing thing. And you and I have been having this conversation for a few years now. Yeah. And it's remarkable to see how it has evolved in a relatively short amount of time. I think both the COVID pandemic has highlighted how vulnerable individuals and communities are around the country. I think the deaths from a social impact, whether it's George Floyd and others, how it has brought health equity and race into the conversation. And we're seeing that from employers around the country, and how organizations are starting to link health equity and social determinants of health in the same conversation. And many times I think what we've seen is organizations start to think about addressing social determinants of health is an active step to addressing health equity. And we see that as, I think, going really hand in hand. And because there is such need, it creates the impetus to start.
I'm glad you brought that up, because you had a great slide about words matter and definitions. And I was going to ask about health equity, because I do think often health equity and social determinants get commingled, and they're very different things, although they are very related. And so I think, we certainly have employers and all stakeholders leaning into both issues very sincerely right now, and they should be viewed in their own rights for their own reasons, but also, I think to the point you just made, they are very directly related in many instances, and can be additive to the efforts when thought about really holistically from that perspective too.
Yeah, and I would say that the majority of the conversations that we have with employers, now with plans and health systems, those two conversations, and sometimes teams that might have been different and had different responsibilities, are coming together at minimum and having some of those collective conversations.
All right. Well, with that, Trenor, thank you so much. It's always a pleasure, and it's just so thrilled to have you share all of your wisdom with our audience today. Thanks again.
Ellen, thank you. Really appreciate it. Thanks to everybody.
Thanks again to Trenor. What a terrific way to wrap up Business Group on Health's annual conference. This session certainly did speak to the tremendous opportunity employers and their partners have to use data and information on social risk to deliver better health outcomes for all, and to leverage novel community partners in the process. To you, our audience, we appreciate your attention and engagement throughout these past 3 days. As a reminder, you will be able to listen to sessions you may have missed for the next 30 days on this conference platform. Thank you to our speakers and sponsors for your incredible support and partnership. We could not have delivered this fantastic event without your contributions and support. We look forward to hearing from you in the weeks ahead, and please do share your conference feedback on the evaluation. Also, please be sure to mark your calendars for April 19th through 21st, 2022 for our next annual conference, when we hope to be live in Nashville. On behalf of the entire Business Group team, we wish you good health and happiness. Thanks again.